Hi guys, welcome back to Sadok Health, a channel where you're going to know more about your health. You ask a question and it gets answered. We're trying to bridge the gap between the doctor and the patient by giving you very right and accurate information about your health so that you can make better health decisions. So our topic today, we're going to talk about a big problem that's usually ignored. Some people have lost jobs because of this problem: painful periods. We're going to discuss what causes painful periods, the different types of painful periods, the home remedies, and hospital management. So why don't you get yourself a cup of coffee and a glass of juice. Welcome back to the channel. My name is Dr. Dan. I'm here with Dr. Jogodoch, who will be telling us more about painful periods.
Thank you so much, doctor. Painful periods, that crampy pain, especially the lower abdomen, sometimes or most times radiating to the lower back, and the pain can get referred as well to the thighs. Periods are a normal physiological occurrence. They are not supposed to keep you away from work. They are not supposed to make you lose your self-esteem. But in cases that this happens, then what exactly is going on? To look at this better, we are going to look at this from the different types of painful periods, medically called dysmenorrhea. We have primary painful periods, which is primary dysmenorrhea, and then secondary painful periods, which is secondary dysmenorrhea. So let's take a look at primary dysmenorrhea, which is primary painful periods. In primary painful periods, the pelvic organs, which is the uterus, the fallopian tubes, the ovaries, they totally have no problem. Okay? And then other things like, for example, a sexually transmitted infection screen is negative. You have probably done a pelvic scan and it's normal. And then other symptoms that could probably make you think that there's a problem, like for example, bleeding in between your periods, probably having heaviness in the lower abdomen, weight loss, fevers, abdomovaginal discharge, all these are absent. There's a hormone called prostaglandins. Remember this very well because during the treatment we are going to hit this hormone very hard. So prostaglandins, this hormone is produced within the uterus during your periods. The hormone causes the uterine muscles to contract and what? Expel what is being shed off from the uterine lining. Remember, when the muscles contract, the blood vessels are squashed, they are squeezed, meaning blood supply to the uterine muscles are reduced. Oxygen definitely being supplied in blood is also reduced, and low oxygen will cause pain in the uterine muscles. That is one. Some women have heavy periods that come in form of clots. Just imagine all that is being shed from the lining of the uterus is passing through that small opening called the cervix. And now there are clots. What does that mean? The muscles have to work harder to push these clots out. And what did we say? The more the muscles contract, the more the blood vessels are squeezed, the less the supply of blood and oxygen to the muscles. So what does that mean? Pain. If this is the cause, what are the risk factors? Is there anything that can make you have painful periods even when you don't have any problem with your pelvic organs? Yes. One, if in your family there's a history of painful periods, probably your elder sister or your mother, then most likely you will also have painful periods when they start. Two, starting your periods at an age less than 11, that is what we call menarche, the first period. When it comes too early, then most times it is always going to be painful. Number three, obesity. I've not heard any good thing about obesity. Unfortunately, majority of obese people, that is overweight people, will also have painful periods. Smoking. There's nothing fancy about smoking. Smoking may cause you lung cancer, but it will also cause you painful periods. These are some of the things that can lead you to have painful periods. Now, what about secondary painful periods, which is called secondary dysmenorrhea? In secondary dysmenorrhea, the pelvic organs have a problem. There's a pathology going on with these pelvic organs. How best can we look at this? When, for example, you have had your periods all the way from when it started up to the age of 25, they were not that painful. You could really control them. But now they've become so painful. When they start, you are unable to go to work. Your self-esteem goes down. Why? Because you are cramping. Let us look at some conditions that can cause you painful periods, what we call secondary dysmenorrhea. One, we have heard about endometriosis. With endometriosis, some of the lining of the uterus is attached, for example, in the fallopian tubes, in the ovaries, outside the uterus, maybe in the abdominal cavity. And remember, the lining of the uterus, as it occurs, every month it will build up, and then later it will bleed, it will be shed off. So just imagine shedding of blood within the abdominal cavity that is outside the uterus. Definitely you will end up with pain. The other thing is adenomyosis. Forgive me about these medical terms, but let me explain it. Adenomyosis, the same lining of the uterus, is now not in any other part, but it's in between the layers of the uterine muscles. So what happens? It also builds up, and when time for shedding comes, it will also what? Get shed off. So just imagine bleeding in between the muscles of the uterus. More contraction, less blood to the muscles, less oxygen. So what does that mean? More pain. Apart from adenomyosis, we take a look at pelvic inflammatory disease. We have talked about this in our previous videos. If you have not watched sexual transmitted infections and how they end up in PID, please follow our previous videos. PID will end up with probably scarring on the walls of the uterus, the fallopian tube, and maybe damage to the ovaries as well. During shedding off that contraction, the muscles are contracting irregularly. So what does that mean? More pain. Apart from PID, there's what we call ovarian cyst. We have all heard about ovarian cyst. Unfortunately, when it is present, you will also end up with painful periods. Other things are uterine polyps, a mass growing up within the cavity of the uterus. So what does that mean? Just imagine the uterus is trying to expel the blood which is shed off from the walls of the uterus. And now there's also a mass. So definitely the muscles will contract further and cause what? More pain. These are some of the things that can cause us secondary dysmenorrhea or secondary painful periods.
Thank you, doctor. Now that we have looked at the different causes and the different types, how are we able to treat from home or from hospital?
So treating primary dysmenorrhea is different from treating secondary dysmenorrhea. Primary dysmenorrhea, there's totally no problem. So what does that mean? You don't probably have to visit a doctor. So what can be done? There are some home remedies that can be very useful. One, positioning. Some of you, when periods are there are certain positions you take. Probably head to knee position. Some of you lie flat on your tummy and you find that the pain is relieved. So whichever position that helps, please take use of it. The other thing is exercise. And I know someone is probably going to tell me, doctor, are you crazy? Watch out. Exercise is very important. Why? I'm not talking about you enrolling for karate classes and trying to kick out that pain. No. Probably you can do something like yoga. You can do some stretches. Why? Because exercise helps release some hormone called endorphins, what we call the feel-good hormones. Endorphins will help suppress the pain, especially the sensation of the pain. Apart from that, it will lift your mood since it's a feel-good hormone. So when the moods are lifted, what does that mean? You will focus less on the pain. Apart from exercise, we can take advantage of hot water bottles, which are almost everywhere. They are quite popular. But remember, don't place the hot water bottle direct to your skin. Why? Because you can end up with burns. Place something in between the hot water bottle and your skin, probably a towel or a piece of cloth, whichever that helps. There are other things probably that you have tried and have helped you before, maybe taking a walk, being around people, and all that, okay? And then, if that is not helping, there are some medications that have always helped. And this is where we knock prostaglandins, what we call non-steroidal anti-inflammatory drugs. How do they help? Non-steroidal anti-inflammatory drugs will prevent or reduce production of prostaglandins. So what does that mean? When prostaglandin is less or is totally not produced, the contraction of the uterus is less pronounced. So the blood vessels are less squeezed, supply of oxygen is not altered with, and supply of blood is not altered with, so you end up with less pain. There are quite a number of non-steroidal anti-inflammatory drugs in the market. For example, ibuprofen, going by the trade name, the popular trade name called Brufen. We have celecoxib, we have aceclofenac, we have mefenamic acid, meloxicam, quite a number of them. But remember, not everyone is fit to use these drugs. So it is important that you get it as a prescription drug. Why? Because people with asthma, people with bleeding disorders, people with kidney diseases, we don't advise that you use NSAIDs. So ensure you get what? A prescription from a doctor. Then what about secondary dysmenorrhea? Something that has a cause, the best way to treat it is to treat the cause. So if it is endometriosis, then get it treated. If it's PID, get it treated. If it's ovarian cyst, get it treated. Why? Because we can only treat secondary dysmenorrhea by treating the cause.
Thank you, doctor. That was an immaculate presentation. And I hope you guys out there, you have enjoyed it and have watched to the end. I hope you're able now to treat painful periods from home using the described home remedies. And once the pain passes, you'll be able to see the doctor. If you've enjoyed this video, don't forget to like, share, and subscribe to this channel. Also, don't forget to hit the notification button so that when we upload our next videos, you'll be informed. Thank you for watching, and bye-bye for now. Sedok Health,
Ask the doctor.